Here's something frightening that most office workers don't understand. Untreated acute pain from poor ergonomics can transform into chronic pain syndrome through neuroplastic changes in your central nervous system. At that point, even correcting the initial cause may not resolve the pain because the nervous system itself has changed. Let me explain the transition from acute to chronic pain. Acute pain results from tissue damage or inflammation. You strained a muscle, compressed a nerve, or inflamed a tendon. This is appropriate pain serving a protective function, telling you something is wrong. It typically resolves within 3 months as tissues heal. Chronic pain persists beyond 3 months and involves central nervous system changes where the pain signal processing itself becomes dysfunctional. The mechanism is called central sensitization. Repeated pain signals from ongoing poor posture create increased sensitivity in neural pathways transmitting those signals. Your nervous system amplifies pain signals, a phenomenon called hyperalgesia, where painful stimuli hurt more than they should. Normal stimuli that shouldn't hurt become painful, called allodynia. Structural brain changes occur in chronic pain patients, visible on functional MRI imaging showing altered activity in pain processing regions. The timeline matters enormously. The first 3 months represent a critical window. During acute pain, addressing the underlying cause, fixing ergonomics, doing physical therapy, reducing inflammation, typically resolves symptoms as tissues heal. After chronification, the same interventions may provide minimal relief because you're now dealing with nervous system dysfunction, not just tissue problems. Risk factors for pain chronification include poor initial pain management, ignoring early symptoms hoping they'll go away, catastrophizing and fear avoidance behaviors where you develop anxiety about pain and restrict activities beyond what's physically necessary, which paradoxically worsens outcomes. Inadequate treatment of underlying causes, using pain medication to mask symptoms while continuing harmful work postures. And psychosocial stress amplifying pain signals through complex brain mechanisms. Prevention strategies focus on aggressive early intervention. When pain begins, address it immediately rather than toughing it out for months. Treat both tissue components with appropriate physical therapy and nervous system components by managing stress and avoiding catastrophizing thought patterns. Build psychological resilience through techniques like mindfulness and cognitive restructuring. And crucially, correct ergonomics before chronic changes occur. This is your window to prevent permanent sensitization. But what if prevention failed and you're already dealing with chronic centralized pain? Management approaches shift significantly. Structural fixes like ergonomic chairs or surgery often don't resolve pain that's maintained by central nervous system changes rather than ongoing tissue damage. Treatment needs to address the nervous system directly through approaches like acceptance and commitment therapy, helping you change your relationship with pain. Pain reprocessing therapy retrains how your brain interprets signals. Graded exposure gradually increases activities you've been avoiding from fear, demonstrating that movement doesn't cause the harm you've been anticipating. Understanding this transition from acute to chronic explains frustrating treatment failures. You've spent thousands on ergonomic equipment, physical therapy, and medical treatments, but pain persists because those interventions address peripheral tissue problems while your central nervous system maintains pain independently. This isn't failure of treatment or a lack of effort. It's mismatch between intervention and actual pain mechanism. The insurance and healthcare system creates barriers to appropriate chronic pain management. Multidisciplinary pain programs addressing biological, psychological, and social components show the best outcomes for chronic pain, but insurance coverage is often inadequate. There's bias towards surgical and pharmaceutical interventions despite evidence that behavioral and psychological treatments are often more effective for centralized pain. The system reimburses a 15-minute medication prescription visit readily, but balks at covering 12 weeks of comprehensive pain psychology. For people caught in this situation, advocacy becomes necessary. Request referrals to comprehensive pain management programs, not just pain medication management. Seek providers who understand the biopsychosocial model and central sensitization. And recognize that chronic pain management may look different from acute pain treatment. Success might mean improved function and quality of life despite ongoing pain, rather than complete pain elimination. The preventive message is urgent. Address musculoskeletal pain early and comprehensively. That nagging neck pain you've tolerated for 6 months could be in the process of chronifying right now. Your window for straightforward resolution is closing. Don't wait until you've developed a chronic pain syndrome requiring years of complex management when months of proper ergonomics and treatment would have resolved it completely.